So, in our communicating with patients with mental illness sections, we've talked a bit about general thoughts of communication and considerations about things like disparities. But let's talk a little bit about how to discuss or consider mental health treatment and communication from a culturally informed lens. So, it is really important to understand that mistrust is really common. Mistrust in healthcare is really common in certain populations. This is largely prevalent within the African American population or Black American population. And this has to do with the history of how Black Americans were treated in the healthcare system. So there is certainly more hesitancy for treatment, even vaccinations, mental health care, as well as physical health care. And Black adults are less likely to this day to be offered evidence-based treatment and medication. Okay, so it's really important to understand that context of their treatment to help inform your communication. We also have to understand that there are a lot of misconceptions regarding mental health, whether it's the pathophysiology of mental health, whether it's the treatment, the causation. Mental health considerations and concerns are still very taboo in a lot of religions and cultures and societal, both macrocosms and microcosms. And these can be barriers that you can't just ignore and you can't discredit. You have to work with and around sometimes. We also see differences in collectivist versus individualist cultures. So the United States is an individualist culture versus certain other countries like China, for example, which tends to be more collectivist in nature. And how this can impact communication as well as treatment with collectivist cultures, a lot of times it's more obedience focused and low levels of personal and emotional expression, individualization, where in individual cultures, there's a lot more of that. Now, again, this is a generalization and it does not apply to everyone who is from China. And individualization is not applicable to everyone who's was born in America. But this can influence how individuals might express their emotions or engage in treatment. So we can't always just say, well, they don't seem sad. They can't be depressed, right? we can't discredit the influence of the expert to the person receiving the care and how deference can happen and obedience and minimization can happen there sometimes too. So being cognizant of that. And of course, we have differences in religious affiliations and belief systems, as well as family differences, cultural differences, and this can influence the shared decision making. So some cultures or family units might have authority placed on certain individuals within the family over others, and they are more likely to be involved in care and decision making. There may be more shame or concern about treatment seeking activities. There may be certain diagnoses or treatments that are not aligned with an individual's religious background or their family or cultural values that have to be asked about and taken into consideration. So how do we do this? How do we actually address some of these barriers? Well, one thing I haven't mentioned yet is language barriers. Language barriers can be really, really challenging and should not be met with a family member interpreter. If at any point there's a communication that may be with someone who will have difficulty understanding in the language that you comfortably speak, you should be doing everything in your power to get an appropriate trained translator. We also want to remember that we should be culturally informed, but individual focused. So be familiar with the population or populations that you're going to be communicating with and treating in terms of how their general differences look, but recognize that just because someone is Black, or just because someone is Muslim, or just because someone is bisexual, that doesn't paint the whole picture of their interests or their perspectives or their priorities just because they're part of that culture. So, for example, our Latinx population, they often take a lot from spirituality and morality and treatment, but we can't just assume that. It's important to ask how this might play a role in how they approach treatment and their involvement with their, spirituality components in quality of care, quality of life, but don't assume. We want to be understanding of different belief systems, even if you don't believe in that system yourself, because it's important to the patient. And we want to recognize that. Share your experience. Be transparent and honest about your experience and comfort level with the characteristics of your patient. So you can say, for example, this is a quote, right? I've received training in the care of patients who identify as African American, but I want to know what your individual needs are. I want to know where you're coming from. Just because I kind of understand how a lot of people who have a shared background with you might prefer their care or might share their indecision making, I recognize that this doesn't necessarily apply to you as an individual. And at the end of the day, we want to be respectful. We want to be respectful of people's belief systems. We want to be respectful of their priorities, provide them with objective information, validate their concerns, and try to maintain that therapeutic rapport when discussing sometimes really sensitive information.